I am Dr. Sajid Ahmed Afzal, cornea and refractive surgery consultant and Chief Medical Officer of Vasana Care, Hyderabad and Himayat Nagar branch. I will be looking after the cornea and refractive department. As far as the cornea is concerned, we have an infrastructure to manage medical cornea as well as a surgical cornea. So medical cornea mainly involves the infectious diseases of the cornea, which will treat as a tertiary care center in this hospital, and we also do corneal surgeries like corneal transplantation and mainly the management of the keratoconus. The keratoconus is an emerging disorder in ophthalmology, and we have got a lot of treatment available now for the keratoconus from past 2 to 3 years. Previously only keratoconus contact lens was the only treatment, and we need to follow the patient till it gets a stage where we have to do a corneal transplantation. But as of now, we have got treatment for keratoconus, and we can stop the progression of the keratoconus by doing collagen cross-linking. There is a latest treatment available with us that is available in India since almost 2 to 3 years. So once the patient is not eligible for collagen cross-linking, that is C3R, then we will think of corneal transplantation. Again, in corneal transplantation, a lot of advancement has taken place, like lamellar keratoplasties, where we will remove only the diseased part of the cornea instead of removing the total cornea, and we replace that diseased part. That is, cornea is consisting of 5 layers. Out of 5 layers, only 2 to 3 layers, suppose if it is involved diseased, then we will remove only 2 layers and replace by the 2 layers of the donor cornea. By this, the rejection chances are very less, and the efficiency of the treatment is very good. So that is the one treatment we are mainly targeting it as far as the cornea is concerned. The other treatment for the keratoconus is the intacts. We will put the intracorneal rings to reduce the power that is induced by the keratoconus. Keratoconus mainly is a conical cornea which involves young people and professionals, which causes the decrease in the visual acuity, blurring of the vision, and they will become visually handicapped. So by giving this treatment, we can able to help them to pursue their studies as well as the professional careers. And as far as refractive surgery is concerned, refractive surgery mainly involves the removal of the glasses and contact lenses. So it has got lot of options available for nowadays to treat the refractive surgeries, like LASIK, epiLASIK and implantable collamer lenses. Suppose a patient comes at the age of 18, we do all refractive surgeries after 18 years of age only. Once we believe that this glass power or refractive error will stop progressing by the age of 18 years. So after 18 years, we can take up for the refractive surgeries. In again refractive surgeries, various methods are available, like LASIK. What exactly we do in LASIK is the corneal flap will take out, and we will try to give a laser to the bed and correct the glass power and replace back the corneal flap. By doing this, we can able to correct up to -6 to -7 diopters of myopia, that is glass power, depending on the individual corneal thickness. And also we have got epiLASIK. epiLASIK will correct even higher refractive error, like -9 to -10 diopter of power. What we exactly do in the epiLASIK is, instead of taking the corneal flap, we will just debride, take out the epithelium, that is the first layer of the cornea, and we will try to give the laser to the bed, correct the power and put the contact lenses. Within a week, that epithelium regrow and patient can see very clearly. By this method of epiLASIK, we can able to correct up to even -10, -12 of dioptric power of glass power. If the patient is even not eligible for this, suppose the patient has got severe dry eyes, patient has got keratoconus suspects, and patient is cornea is very thin, then we have other modality of the treatment by which we can able to correct even up to -26 or 27 diopter of the power by placing the implantable collamer lens. That is the ICL surgery. There is a unique surgery by which we can able to correct even the power up to -25 to 27 diopter of power. So by the various treatment available with us, So we can able to give a quality treatment at the affordable cost. So that's all about the Vasan Eye Care. Thank you.